Hello everyone. So in this video we are going to talk about dementia. Per se, dementia is not a disease. Rather, it is a syndrome that is characterized by deterioration of the cognitive function. What actually is cognitive function? It is ability of one to process the thoughts. Mind you, the memory is just a component of cognition. The other components of cognition includes one's behavior, the language, memory, thinking skills, orientation to time, place, and person, calculation abilities, and learning processes, and many more. Okay, memory is just a component of cognition. Mind you, the consciousness is not affected in the case of dementia. Okay, so patient is conscious all the time until there is a severe case of dementia. When we go on to see the burden of dementia, it is the major cause of disability and dependency among the older people worldwide. It causes personal, economical stress among the family members too. The sign and symptoms are different and affect different individuals in different way. Why this is so? It is because of the impact of disease differ in different person. Also, the personality before the development of disease is an important factor deciding the sign and symptom with which the patient of dementia will present. Making it easier to understand, we have three stages of dementia: the early stage, the middle stage, and the late stage. The early stage is often overlooked, and the symptoms here develop so gradually that it is overlooked. The symptoms include forgetfulness and losing track of time. Often, while consider a person coming to home forgets a familiar place which was well known to him. We also need to know that the cognitive decline occurs with age, but it is very slow, okay, and it is natural. But this cognitive decline or deterioration of cognitive function is out of proportion to the age increase. After the early stage, we land up into the middle stage where the person loses patient often loses track within the home itself, and the patient need to be helped with his personal care. In the later stages, an important point to note is that the patient's bowel and bladder habit starts changing and need to be managed. Okay, this is somehow the last stage where the when the patient is in his last stage of the life. Also, in the late stage, the patient is unaware of the time and place. Okay, means the consciousness level here starts to decline. So these were the three stages. Let's try to understand the types of dementia now. So we have cortical dementia involving the cortex of the brain. These include the Alzheimer's disease, the Pick's disease, that is frontotemporal dementia, the Lewy body dementia. The subcortical dementia include the Parkinson's disease, okay, and there is a vascular dementia characterized by multiple infarcts. The most common of them is Alzheimer's disease. Now we will talk a bit about each of these diseases. So let's start. Talking about Alzheimer's disease, it is the most common cause of the dementia, and the initial symptoms include difficulty in remembering names and recent events. Later on, the patient also develop impaired judgment, disorientation to time, confusion, and behavior changes. He also may develop trouble in speaking, swallowing, walking, that are daily events, so life become very miserable. The pathophysiology behind this is suggested to be deposition of beta amyloids, that are plaques and twisted strands of protein tau tangles in the extracellular space within our brain. These are the neurofibrillary triangles that are formed by the protein tau. Talking about another cause of cortical dementia, we have frontotemporal dementia. Here we have damage of the brain cells, especially the brain cells located in the frontal lobe. So the changes are in personality, behavior, and difficulty. These are very characteristic of this dementia because it is involving frontal lobe. Also, there are not in general we see any microscopic abnormality, but in case the frontotemporal dementia, if it is due to Pick's disease, we often see Pick's body in the microscope, and Pick's disease is a type of frontotemporal dementia. Only 2 points that everyone should know about normal pressure hydrocephalus is that It is because of buildup of fluid in the brain, and we see a classical triad where the patient has difficulty in walking, memory loss, and inability to control the urine. Important points about vascular dementia is that it is the second most common type of dementia following the Alzheimer's disease, and so its symptoms most of the time are similar to Alzheimer's disease, except here the memory may not be as seriously affected as in Alzheimer's disease. This occurs because of decreased blood flow to parts of brain because of formation of series of small strokes that block the arteries, and there we can see multiple infarcts in the area of the brain when we do a scan. So Parkinson disease is already discussed, but few points regarding it is that in later stages of Parkinsonism, the patient develops dementia, and the hallmark abnormality is Lewy body. That is an abnormal deposit of protein alpha-synuclein that forms in the inside the nerve cells in the brain. So last cause to be discussed is CJ disease, that is Creutzfeldt-Jakob disease, also known as mad cow disease. This is a prion disease that is caused by misfolding of the prion protein and is a less or the rarer cause of the dementia. But there are a lot of causes to be discussed. These were some of the important causes which everyone must know, the causes of dementia. Let's move further. So after knowing a bit about each of these diseases, we will go into some further details. The risk factor for dementia, the strongest and the most important risk factor in dementia is age. But mind you, not everyone with age develops a deterioration of cognitive function. There are conditions where we see pre-senile dementia, and it is seen in about 9% of cases. Other risk factors include modern world disease. These include smoking, alcohol, healthy diet, compromise, increasing cases of hypertension, increased cholesterol intake, junk food intake. So these are all modern world. These all result in modern world diseases, and that is what is contributing to the risk factor for dementia. We diagnose this disease mainly by the medical history. Most of the cases have a family history positive for dementia. Also, some medications are proven to deteriorate or worsen the conditions of dementia. We do the physical examination. Neuropsychological tests include battery of tests like Bhatia battery of test and other tests. We have brain scan to be done, which can rule out other mass lesions within the brain. Treatment, we need to understand that this condition has no cure. Only the thing we can do is we can decrease the progression of the disease to improve the life of the patient. These include giving the acetylcholinesterase inhibitor. These acetylcholinesterase inhibitor will decrease the depletion of the acetylcholine. Acetylcholine is an important neurotransmitter and hence will decrease the deterioration of the cognitive function. These acetylcholinesterase inhibitor include donepezil, rivastigmine, and galantamine. The rivastigmine is mainly used when the patient has increased incidence of hallucination. Rivastigmine is of better. It has to be found that it is better than the donepezil and galantamine. We need to note that these acetylcholinesterase inhibitor, when taken initially, the patient has nausea and loss of appetite, but with time, after 2 weeks of the therapy with these drugs, the patient get used to and shows better results. So these were some bits about the dementia we needed to know. Thanks for watching.